This is Module 7, Coronary Vessels, Anatomy and Pathology, Module 7A, Cardiac Tomographic Anatomy. Most cardiovascular specialists are very well aware of the general spatial orientation of the coronary arteries from prior experience, including direct coronary angiography. Importantly, though, when learning to understand coronary anatomy using tomographic imaging with cardiovascular CT, it must be appreciated that the relationships of the arteries to each of the branches is important, but also the location of the various veins and vein connectors which intersect or burrow in close association with the arteries, so as not to confuse which vessel is which. In particular, one needs to be aware of the location of the anterior cardiac vein, which parallels the left anterior descending and then passes either above or beneath the proximal left circumflex as it continues to eventually form the coronary sinus. Another important vein is the middle cardiac vein, which tends to parallel and sometimes spiral about the posterior descending coronary artery, supplied normally from the right coronary artery, but also oftenly supplied by a dominant left circumflex artery. This is again a representation of the tomographic relationship between the individual arteries, given in red, and the individual veins or venous system, given in yellow. Long axis and short axis orientations can also be visualized, even though consistently we acquire the data in two-dimensional format. We must continue to assimilate this into three-dimensional characteristic anatomic definitions. We're going to briefly review cross-sectional tomographic imaging using CT from the transaxial imaging plane. This is level 1 at the base of the heart, slightly above the takeoff of the coronary arteries. For orientation purposes, the sternum is in the front, the spine is in the back. However, physically we are looking from what we call the foot view, that is, looking up from the bottom towards the head. Thus, the physical right side of this image is the patient's anatomic left, and the physical left side of this image is the patient's anatomic right. In this particular level, at the center of the aortic root, one can see the ascending aorta, proximal pulmonary artery, and the superior vena cava. Next level, approximately 3 to 4 centimeters below that, we see the beginning of the left anterior descending coronary artery. Note importantly that sometimes tomographic imaging, since we think of the left anterior descending as an anterior descending vessel, it prominently can be what's called a left anterior ascending, such that the proximal or early part of the mid-right coronary may be physically cephalad to the takeoff of the left main. That's exampled in this particular image, where we can see a portion of the proximal left anterior descending without, in the same tomographic plane, seeing the origin of the left main. The right ventricle is seen anteriorly. We can also see the superior vena cava, right pulmonary vein, and the pulmonary trunk. Approximately 3 to 4 millimeters below this, we can now see the beginning of the left main, as well as at least a portion of the proximal and mid left anterior descending coronary artery. Note the anatomic relationship between the right ventricle, superior vena cava, the right pulmonary vein, and other anatomic structures within this same purview. The next level down, we begin to see the mid portion of the left anterior descending and a portion of a diagonal branch of the left anterior descending. We see now the level of the right atrium, the superior vena cava, again the pulmonary veins. Next level down, we begin to see the beginning of the circumflex artery, and we are already into the mid to distal portion of the left anterior descending artery, as well as a diagonal branch. Notice that even at this level, we have not seen the origin of the right coronary arteries, since this is physically caudad to the takeoff of the left main coronary artery. You can also see the ascending aorta and the right ventricle. At this level, we are now just beginning to see the ostium of the right coronary artery coming off in the anatomic image on the right, however, physically an image on the left using the foot view for typical tomographic imaging. We can also see the beginning of the circumflex and the groove between the atrioventricular areas. Next level down, we begin to see a portion of the right coronary artery, the right atrium, the left atrium, the mid-circumflex artery, and we already are into the distal left anterior descending coronary artery. Next level down, the right coronary continues to be apparent in the proximal portion. We're now in the distal circumflex and clearly in the distal left anterior descending, or perhaps in the apical segment of the left anterior descending. Next level, we see the mid portion of the right coronary, the apical portion of the left anterior descending, and the distal portion of the left circumflex artery. Notice also the association between the right atrium and the left atrium, and the apparent separation in the inner atrial septum. Next level down, we see the right coronary in the mid portion, the apical left anterior descending, and a distal portion of the left circumflex. Further down, we again still see the mid portion of the left anterior descending, the apical portion of the LAD, and we are now beginning to see the inferior vena cava and the origin of the coronary sinus into this structure. Next level down, we see the distal portion of the right coronary artery, and the same anatomic level we begin to see a portion of the right hemidiaphragm, or perhaps portion of the liver, and the inferior vena cava. Last level down, we also see now the liver quite clearly, and we see a portion of the right coronary artery in the right posterior descending groove.